Now let us have a look at another communicable disease. In fact, a group of communicable diseases which has been asked so many times of in your exam, 5 by 5 star MCQ topic. Many times they'll talk to you about plague vectors, what is the mode of transmission, incubation period, vaccines in plague, so many things. Yellow fever, particularly, they will talk to you about the vaccines in yellow fever, and in Kajnur forest disease, what is the mode of transmission, and so on. So now let us take a look at each of these diseases one by one, and let's start with the first one, that is plague. If you talk about plague, as always, we have always talked about the epidemiological determinants. We need to talk about the agent factors, the host factors, and the environmental factors. Let's talk about the agent factors at the first place. What is this plague caused due to? Plague is caused by Yersinia pestis. Yersinia pestis. This is what? It is a gram-negative, non-motile Coccobacillus. And this Yersinia pestis, it shows what? It shows bipolar staining. What is the specific stain we have? Bipolar staining. What is the specific stain we have is the Wiesen stain. The plague bacilli is stained with Wiesen stain. It can also stain with the Giemsa stain. And both these stainings are there for plague bacilli. That is about the Yersinia pestis. And next is, what are the reservoir for plague? Reservoir for plague. And what is the source of plague? They are different. What is the reservoir for plague? Reservoir are small mammals, or these are the small or the wild rodents. So different rodents are there. I also came to know about different rodents when I was studying much in detail about plague. So I'll just share with you the different rodents or the wild rodents that you need to remember is mice, or we can have the rats. Which rat? It is the special field rat. Field rat is more known to cause a plague. And then we have the gerbils. Gerbil is also a type of a rat. The gerbil that is most commonly associated, or the reservoir which is there for plague in India, that is the Tatera indica. Tatera indica. That is the Indian desert gerbil. That is recorded as having the maximum amount of plague, and that is one which is implicated in transmission of plague. That is the Tatera indica. It is not the domestic rat. Domestic rat is usually having a very less chance of plague epidemicity or endemicity. Domestic rats are not responsible for plague transmission in India. What are the domestic rats? That is the Rattus rattus. Rattus rattus, that is not one of the main reservoirs. So different wild rodents are there. You can have the Indian gerbil. This is what is the Tatera indica. Tatera indica. Or we have, very commonly we have is the small field rat. These are very small in size and they are very fast. That is the small field rats. And then you have the skunk also. Of course, skunk is not very commonly found in India, but in different parts of the world, skunks are found, and skunks can transmit. In fact, they are the reservoirs of plague bacilli. So these are about the reservoirs. What is the source? Beta, the source for plague bacilli can be only two. Either it is a human. Who human? Which human? It is the case of pneumonic plague. Pneumonic plague, not the other types of plague. So case of a pneumonic plague could be a source, or another source could be your favorite answer, that is the rat flea. What do you mean by rat flea? Who is a rat flea? Rat flea is Xenopsiella Chiopis. So that is about the reservoir, the source, and we have done the agent factors. Let's move on to what are the host factors or the environmental factors. Host factors, nothing very special, just 1 or 2 points, that which factors will promote plague development or plague epidemic. Please note that plague is what? Plague is a zoonotic disease. Plague is a zoonotic disease. It is one of the oldest disease. One of a very old disease which is known to human mankind. It is associated with the host factors like overcrowding. It is associated with host factors like too much of traveling, a lot of traveling, overcrowding with unhygienic conditions. So all these are predisposing to plague. I would also like to tell you that plague, do you know, is also known as Black Death. Black Death. Just before the World War II, the whole world was facing a lot of crisis because of plague bacilli. And plague bacilli is known to cause maximum number of deaths. Do you know that the case fatality rate in an untreated case fatality rate of untreated, I'm not talking about the treated, case fatality rate of the untreated case of plague is ranging from 50 to 100% for untreated case of plague. So that's how bad the plague is. It was known as Black Death. So it has been very strongly associated with the development of humans over last so many civilizations. What are the environmental factors? Plague does have a seasonal trend. Plague is known to be spreading more after September up till May. So probably the winter months are better for the plague bacilli. There is more transmission, and the rat activity also increases once the monsoon season is over. So from September till May, the plague bacilli would be there. The optimum temperature is ranging from 16 to 24 degrees for the plague bacilli with a relative humidity of more than 60%. That actually promotes the plague bacilli transmission. Next is point number 3. What is the incubation period and what is the mode of transmission of plague? The incubation period of plague is very special. The plague can be of 3 types, broad 3 types. That is, we can have a pneumonic plague, or we can have a bubonic plague, or we can have a septicemic plague. Septicemic plague. The incubation period for pneumonic plague, can you believe, is as short as 1 to 3 days. It just happens like this. It happens within a flash of second. That's how is the epidemic or the infective potential of the plague bacilli. The incubation period is 1 to 3 days. You get the infection, you get the disease. That is, you get the infection, you get the sign and symptom. For bubonic plague, it is 2 to 7 days. So the incubation period may be slightly more for bubonic or the septicemic plague, but all said and done, it's a very rapidly coming up infection. That was about the incubation period. Let us have a little bit more in detail talk about the modes of transmission. This is a 3 by 5 star MCQ topic. If somebody is going to ask you question on a plague, it has to be on the mode of transmission. How does the plague bacilli spread? So this plague bacilli is going to spread via this vector. What is the name of the vector? The favorite answer is Xenopsiella chiopes. Different vectors can be there. We can also have the Pulex irritans, that is the human flea. But the most important vector is actually the rat flea or the Xenopsiella chiopes. MCQs on Xenopsiella chiopes. This Xenopsiella chiopes is a blood-feeding vector. It is a blood-feeding arthropod. At one time, it can ingest approximately 0.5 cubic millimeter of blood. So that is the one meal that this rat flea is going to take. In this one meal, the plague bacilli, it could be there from the human, it could be there from the rats. So one meal, that is 0.5 cubic millimeter of the blood from the rats, could have up till 5,000 plague bacilli. So now all these plague bacilli will go where? They will enter the tummy of this rat flea. They go into the stomach of the rat flea, and the plague bacilli is, do you remember? We have talked in many different modules. In entomology, I think we talked about it. In modes of transmission, when we talked about infectious disease epidemiology, we again talked about it. That the plague bacilli will show what a transmission. Please note that the plague bacilli, write down in Sunehre words, write down in golden words, that the plague bacilli will show a propagative transmission. Can you remember this? Plague bacilli, P for plague, P for propagative transmission. So the plague bacilli is going to show a propagative transmission. What do you mean by propagative? That the plague bacilli is going to enter, it will go replicate. There is no change in shape, there is only change in number. So there is a propagative transmission. Now the plague bacilli is there everywhere in the body of the plague, of the Xenopsiella chiopes. This flea is called as a blocked flea. This flea is now called as a blocked flea. Please note, I told earlier also that how does plague spread? Does it spread by rat flea? Answer is no. Plague does not primarily spread by a rat flea. It spreads by a blocked rat flea. Plague is a disease. Try understanding and listening very carefully, bache now. Plague is a disease of whom? Plague is a disease of rats. So plague is a zoonotic disease. Plague does not happen to human, but plague is a disease of the rats. So the rat flea bites the rat. Why do you think a rat flea will bite a human? Will a rat flea bite a human? Answer is no. If it was biting a human, we could have called it a human flea. We call this rat flea as a rat flea, bache. Why? Because it bites the rat only. So now the rat flea is going to bite the rat. There is a lot of plague bacilli which is spreading, and the rats are there, rat, and the flea, everywhere flea. So now there is so many fleas everywhere in this rat. Now try understanding, there is a plague which is spreading in the rat, and now the flea is going to bite the rat. If you have understood this phenomena, now if the flea bites the rat, instead of throwing the plague bacilli, she or he takes more bacilli. So now this flea is violent. Now this flea goes mad, like it loses its mind now. Because what is happening on earth? Instead of me throwing the plague bacilli, I'm getting more plague bacilli, and plague bacilli is doing plague inside. That is the propagative cycle. So this flea becomes a blocked flea, and this blocked flea will be violent. It is now ferocious. And now because this rat flea is ferocious, it understands that if I bite this particular rat, instead of me throwing the plague bacilli, I'll get more feed bacilli. So now it stops biting the rats. Now it spreads to dog. It will bite the cat. It will bite the human, horse, anything it is going to bite. So humans will have a soft skin, so it is easy for a rat flea to bite a human, and therefore the human is the recipient of the plague infection. Did you understand this? So please note that who is going to spread? It is not the rat flea, it is a blocked rat flea which is going to spread. MCQ number 2, what is more dangerous? Is it a blocked flea which is going to spread, or is it a partially blocked flea? Partially blocked flea. Please note that it is the partially blocked flea which is most dangerous. Why do you think partially blocked fleas are more dangerous? Because they are going to have more lifespan. So they are going to stay with the plague bacilli for almost entire life, whatever time of generation time they have. So that is the reason we say that the partially blocked flea are more dangerous than the blocked flea, and both are main important vectors for transmitting the plague bacilli. If you understand all this, let us move to the topic number 5, that is the plague vector indices. So what are the vector indices? Bache, we can broadly have 4 vector indices. That is the total flea index, or we can have a specific index, that is a Chiopis index. And another one is a specific percentage of flea, specific percentage of flea. And the fourth one that we have is the Burrow index. So what do you mean by all of these? So what do you mean by the total flea index? It is the total number of fleas per rat. So total number of fleas per rat, that is a general index. There are so many different types of fleas. We can have rat flea type 1, type 2. You have so many Xenopsialas, different species are there. And then you have the human flea. You have different types of fleas. So all the total number of fleas per rat, that is a total flea index. Next is Chiopis index. What is Chiopis? It is a specific flea index. It is a specific flea index. What do you mean by the specific flea index? That is, Chiopis index is the total number of Chiopis per rat. So how many number of Xenopsiala Chiopis you have in one single rat, that is going to tell you about the Chiopis index. Please note that Chiopis index, it is one of the most important and the most sensitive criteria about the plague. So when a plague outbreak is there, what is going to happen to the Chiopis index? What do you want to say? So if the plague bacilli is spreading in the area, there are so many rats, so many plague everywhere. What do you think is going to happen to the Chiopis index? The Chiopis index will increase or decrease. Because there is more plague bacilli in the rats, the rat may die. if there is death of the rats, what will happen to the flea per rat? Chiopis flea per rat. Chiopis feeds only on the rats. So what will happen to the Chiopis flea per rat? The Chiopis flea per rat is definitely going to increase. This increase is because of the more Chiopis or the less rat. Answer is, it is primarily determinant is the less number of rat. So therefore we say, that is why we say that the death of the rats, or we say fall of rats, this is one of the earliest sign of upcoming plague outbreak. Why? Because there is death of rat is the first thing that is going to happen, and subsequently because there is death of rat, the number of fleas per rat will tend to increase, and the Chiopis rate per rat will also increase, and then the Chiopis is going to bite the humans, which is going to cause all the problems. So the Chiopis index is a very sensitive index for the upcoming of a plague epidemic. What is this specific flea index? Specific flea index, beta, it is the total number of specific flea, whatever flea we are talking of, specific flea, divided by the total fleas in the area. So out of the total fleas, which flea is highest? That is the specific flea percentage. And lastly, what is burrow index? Burrow index is pretty simple. It is the total number of fleas. Burrow index, it's a general index. It is the total number of fleas which are present per rodent burrow. So burrow is where a place where the rodent would sleep, right? So the number of fleas which are there inside the burrow, that is the burrow index. And do you know that one flea can keep on having the plague bacilli? It will keep the plague bacilli for roughly 4 to 5 years. So do you also know that the rat flea, which is there, it can reside inside the burrow. It can stay inside a burrow for approximately 3 to 4 years. So the rat flea will also be hibernating along with the rodents for many years, for many months. It can stay inside the burrow, rat flea. And rat flea, once it is infected, it may remain infected for a very long time. So these were a lot of questions that you get upon the vector or the plague vector and upon the plague vector indices. Next in line, what is the clinical features? So in clinical features, plague can broadly be of 3 types. We already discussed. We can have a bubonic plague, or we can have a pneumonic plague, or we can have a septicemic plague. So what is a bubonic plague? Bubos means the lymph glands. So what happens is that the rat flea is there in the rat population. The rat flea is there. Now the rats start dying. There is plague, and the rat flea will bite the humans. Usually the bite is on the lower limbs. So now the plague bacilli is injected inside the body. Inside the body, it will go to the lymph glands, and to the lymph nodes. And from there, it is going to replicate inside. So now there will be formation of buboes. What is buboes? It is large swollen glands. Usually in the groin area. Axilla is very rare. So usually in the groin areas or in the legs, there will be large bubo formation. This is what is the bubonic plague. This is the most common type of plague that we have, is the bubonic plague. The only MCQ that you can get is bubonic plague. Can it spread from person to person? The plague bacilli, it lives in a very enclosed space in the lymph gland. So this plague bacilli usually cannot be transmitted. Usually there is no person to person transmission. P2P transmission, person to person transmission is usually not there. In a bubonic plague, it is the most common type of plague. Sometimes the bubonic plague may have too much of plague bacilli inside the body, that it may land up into a complication called as pneumonic plague. Usually pneumonic plagues are very severe type of plague. So pneumonic plague is a rare complication. It is a rare complicated type of plague. In this, there is a plague bacilli within the sputum also. There is plague bacilli in sputum. So now if the plague bacilli is there in the sputum, now don't you think that the plague can actually be transmitted? So pneumonic plague is the one which can be transmitted. So this is most hazardous. Pneumonic plague may transmit. That is what makes pneumonic plague as a public health problem. So it may transmit. In fact, not may transmit, it does transmit. There is a person to person transmission of the pneumonic plague, and it is pretty rare. It's a rare thing. It is less than 1% of cases may land up into pneumonic plague. Septicemic plague means the plague bacilli has crossed that lymph glands and it is there in the blood. It is one of the most rarest phenomena and it is very severe. Very severe, the case fatality rate could be like ranging between 30 to 80% in a septicemic or a pneumonic plague. The pneumonic plague patients have to be very categorically, they have to be isolated for all the time. Why? Because the person may keep on spreading the plague bacilli. So this is what you need to know about the clinical features of the different types of plague. Now, as far as the diagnosis of plague is concerned, the diagnosis can be based on simple examination of the plague bacilli by staining methods. So you can take the culture, you can take the specimen and you stain it, staining with Giemsa stain, or a specific stain is the Wesen stain. Or we can also identify the plague bacilli using direct blood culture. Please note that blood culture is taken in all the specimens. This is the one which is gold standard, and it is used for confirmation of diagnosis. Confirmation of diagnosis is always done by blood cultures. Next is, how do you control or manage a single case of plague, usually which does not happen. Usually the plague, once it spreads, it's there in a smaller or a bigger community. It's there like as an epidemic. You don't get scattered cases of plague. So how do you manage or control epidemic or outbreak of plague? First thing that we have always to do is to diagnose the case. Early diagnosis, use blood cultures. We try to do blood cultures in all the susceptible population, all the household contacts. Everybody is being tested for plague in case there is even a single case. So you diagnose. Second is you have to notify. Please note that notification of plague is important because plague is under the international health regulations. You remember in different parts of the lecture I have talked to you CYPIP, CYPIPC, cholera, yellow fever, plague, cholera, yellow fever, plague, influenza, poliomyelitis and COVID-19. So these are some of the diseases which are under international health regulations and they need to be notified. So management of plague would first of all include diagnosis, then you notify. Third is you isolate that patient. You have to do mandatory isolation of the patient for more than 7 to 10 days. And once we are done with all this, we are also supposed to treat the patient. How do you treat? What is the drug of choice for plague? The drug of choice for plague is streptomycin. Streptomycin is given in the dose of 30 milligram per kg body weight. It is given as IM dose, intramuscular. It is given as BD dose for 7 to 10 days. 7 to 10 days. What is the alternate drug in case we cannot give streptomycin? The alternate drug we can give is tetracycline. The alternate drug that we can give is tetracycline. So this is just a very brief about the management and control of the plague. Please note what is the earliest sign. It is the death of the rats, which is the most specific vector index, that is the Chiopis index. There will be a rise in the Chiopis index. So after doing management and control of plague, next we should also take care of the vector of plague, that is the Chiopis or the Xenopsiella chiopis. So what are the insecticides that we may use for vector control? We can use beta DDT. We can also use BHC. We can also use carbaryl. DDT is usually not deployed for plague bacilli. Why? Because DDT requires permission from the health authorities. It's there because it's there in the food chain and so many problems. And there could be DDT toxicity or there could be DDT resistance also. So what we are using is either BHC, which is in tune of 3% BHC, or a 2% carbaryl. But what is the insecticide of choice? We can use either of them. But what is the most commonly used insecticide that we actually use whenever we find a higher number of fleas in an area, or if the rat population starts decreasing, we can use malathion. Malathion 5% is one of the most effective insecticides that we have for the fleas. Most effective for fleas. So what do we do with malathion 5%? You just go and spray malathion 5% in the burrows. in rat burrows. If you spray malathion 5% in the rat burrows, the flea will die. So if you spray malathion 5% in the rat burrows, the flea dies. So the total flea index, because malathion does not know Chiopis only, right? It knows all the fleas. So the total flea index is going to drop to less than 1 within 48 hours. Within 48 hours of spraying, within 48 hours of spray, the total flea index is going to drop to less than 1. So that's all about the vector control that we do about plague. The malathion should be sprayed in rat burrows within how many kilometers? Usually we take a distance within 8 to 10 kilometers. So in a distance of 8 to 10 kilometers, you spray all the malathion in the rat burrows, or you can use BHC or carbaryl, and these are very efficient vector control measures. And lastly, what is the prophylaxis and prevention of plague? Please note that in the prophylaxis, how do you prevent plague? There are only two methods. Either we can give a vaccine prophylaxis, or we can give a chemo prophylaxis. What is the drug of choice for prevention of plague? It is given as tetracycline. It is given as tetracycline at the dose of 500 milligram. It is given as 500 milligram, given 6 hourly for 5 days. That is what is the chemo prophylaxis. It is not very effective way, but that's the best we can do to at least to household contacts of the plague. In case we get an outbreak of plague, it's usually in outbreaks. It doesn't happen one case or two cases, right? We already talked on this. So now, is there the vaccine which is important? Will it be useful during epidemics? Let's have a look at the vaccine. What is the name of the vaccine that we are giving for plague, beta? The vaccine that we are giving for plague is a Salk modified Haffkine vaccine. So basically it was produced in Haffkine Institute, and it was modified by Salk. So this vaccine is not at all very highly efficacious. So it's not something which is you give the vaccine and it's going to prevent. There is a very high chance of breakthrough infections, or we may have some problems. So the Salk modified vaccine is there, but it's not very effective. This is given in 2 doses at the rate of 0.5 ml in the first dose and then 1 ml in the second dose. It is given with a gap of 1 to 2 weeks. That is about the Salk modified vaccine. How much time does it start developing the immunity? The immunity develops in around 5 to 7 days. So that is the time for development of immunity. So now if you understand this, is the vaccine required or is it useful during epidemics? But the vaccine effect will start only after 5-7 days. So that is a problem. Why? Because what is the incubation period of pneumonic plague? 1 to 3 days. Bubonic plague, 2 to 7 days. So within 7 days, the infection actually spreads. So it happens in outbreaks and the vaccine is not effective. It is not effective in outbreaks. In outbreaks, it won't work. So what is the vaccine mostly used for? It is used for emporiatrics. What do you mean by emporiatrics? Emporiatrics is a science of travelers. So people who are traveling to some plague endemic areas or health professionals who will be going to work in the plague infested areas, in the plague outbreak areas, in those cases we may give a vaccine prophylaxis or we may even give a chemo prophylaxis. So that's all about the questions from plague. Next is this yellow fever. Please note that yellow fever is a disease which is under the international health regulations. Yellow fever is found more in the Africa continent. It is also more in South America. And please also note that yellow fever is exotic in India. What do you mean by exotic in India? It is not found in India. In India, you have humans. You have lots of humans, and you have the Aedes mosquito also, which is going to transmit the yellow fever. So you have the vector, you have the host, but you don't have, what is missing is the yellow fever virus, and that is the reason yellow fever is under the international health regulations, under the international health regulations. Why are we so scared of yellow fever? Do you know that yellow fever, if in case it is untreated, there is a case fatality rate of 50 to 80%. It is a high probable, high killing disease. And this case fatality rate happens within 5 to 10 days. So that is how bad the yellow fever is. Please note that yellow fever, let us talk about the epidemiological determinants, about the agent factors, host factors, environmental factors. What is the agent factors? Please note that the yellow fever is a viral disease. It is an arboviral disease and it is metazoonotic disease. What do you mean by metazoonotic? That means that the infection is already there in the animals. It is there in some animals and then it crosses to arthropods and then it may reach the humans. So there is involvement of the animal, the arthropod. That is what is a metazoonotic infection. So this yellow fever is a viral disease. It is from the group of the name of the virus is a Flavivirus fibricus. Flavivirus fibricus, which is from the group of Togaviridae family. And this virus is known to be there among the wild population. So what is the reservoir? Reservoir is usually chimpanzees or the primates, which include primarily the monkeys. It is also there in humans. Humans may also be the reservoir and the mosquito may also be the reservoir. What is the source? The source or the vector for this disease is the Aedes mosquito. Which Aedes mosquito is it? Aedes albopictus. Am I correct? Answer is no. It is Aedes aegypti. Aedes aegypti is known to be implicated in causing, like transmitting yellow fever much more than the Aedes aegypti. Please note that the Aedes than the Aedes albopictus. Aedes aegypti is more common than the Aedes albopictus. Next in line, what is the incubation period? As far as the host factors are concerned, the yellow fever can affect all ages, all types of gender. There is no gender or age like any peak age or any gender preference. The host factors is more related to high risk occupations. What do you mean by the high risk occupations? Which are the high risk occupation for yellow fever? People who are working in forest areas, people who are cutting trees, lumberjacks and all these people who are working with wild animals, they will be more at risk for the yellow fever. You should also know that in case a person gets any natural infection will cause a lifelong immunity. Next point is lifelong immunity with a natural infection. As far as environmental factors are concerned, nothing very special. It is this virus fulminates more in the hot and humid climate, that is temperature of more than 24 degrees centigrade with a relative humidity of more than 60%. Relative humidity of more than 60%. So it's more in the hot and humid climates, and that's why it's there in Africa region and in the South America below the equator. We have more amount of yellow fever. Next is this important 5-star point, like what is the mode of transmission? A lot of times you get questions on mode of transmission in yellow fever. But in yellow fever, there are 3 cycles which are happening. You can call the first cycle as a sylvatic cycle, and then this sylvatic is also called as the jungle cycle, or then we can have something called as the intermediate cycle, or we can have the third one is an urban cycle. In the sylvatic cycle, there is, what is the reservoir for yellow fever? That is a monkey. So in a sylvatic cycle, you will have the mosquito which gives the infection to the monkey, and the monkey is going to give it back to the mosquito. So that monkey cycle is what is there in the jungles. That is the jungle cycle or the sylvatic cycle. In the urban areas, what is going to happen? In the urban areas, the mosquito is going to take infection from humans. So the humans are there. The humans will give it to the mosquito, and the mosquito will give it back to the human. So there is a human mosquito human cycle that is called as urban cycle. Usually the urban cycle is there, it doesn't cause so many spreads. It is there as sporadic infection, but what the problem is this intermediate cycle. What happens is this, there is transmission in the mosquito. Mosquito is one of the reservoirs. So mosquito may spread to the monkey. The mosquito may spread it to the monkey, but the mosquito may also, sometimes humans may go very close to the forest, or they may start cutting the forest. So now the humans will be in close contact with the mosquito, which was in close contact with the monkey. So this type of cycle is quite a disturbing cycle, and this type intermediate cycle may cause some outbreaks. So that is what is the mode of transmission. How does it transmit? So there is sylvatic cycle, there is intermediate cycle, and there is a urban cycle in this yellow fever. Next is, what is the incubation period? What are the incubation period? Incubation period is 3 to 6 days for the yellow fever. If you talk about the mosquito, the extrinsic incubation period, that is how much time does the flavivirus, that is the yellow fever virus, take from getting into the mosquito to the time it comes out of the mosquito and the mosquito is able to spread to others. So this cycle is ranging from 8 to 12 days. And once the mosquito gets infected, that is what you need to write down in star mark. Once the mosquito gets infected with yellow fever, this mosquito is not going to die now. Like, of course, it is going to die. That's how it is. But this infection is not going to die. The mosquito may die, but the infection will not die. How? It is because there is a trans-ovarian spread. There is a trans-ovarian spread of the yellow fever virus in the mosquitoes. So there is trans-ovarian transmission, that is the mosquito will lay eggs and the eggs will be infected, mosquito infected, eggs infected, and the next progeny will also be infected. And once infected, they remain infected for the life. That is what is happening in the mosquito, and this is what is mode of transmission for yellow fever. How do you diagnose and manage a case of yellow fever? The diagnosis is primarily serological. We try to find out the specific IgM for yellow fever, but of course, it's not confirmatory. What is confirmatory? The confirmatory test is RT-PCR. The confirmatory test will be RT-PCR. Very simple. How do you manage? We cannot manage. We don't have a treatment for yellow fever. So it is a symptomatic management. Symptomatic management of yellow fever. There is intense liver failure and the patient is having fever, and there is a cirrhosis. There is acute liver failure in yellow fever. And lastly, like prevention of yellow fever, what is the vaccine? This is again a 7 by 5-star MCQ topic. What are the vaccines that we have for yellow fever? Please note that the yellow fever vaccine is first MCQ. It is a 17 Delta vaccine, 17D strain. This vaccine is a live attenuated. It is a live attenuated vaccine. It is a live attenuated vaccine and it is a freeze-dried vaccine. Because it is freeze-dried, there is a diluent. You can't put powder. There is a diluent which is already given with this. So it is given with diluent. What is the dose of this vaccine? Dose is 0.5 ml given as subcutaneous injection, given in the deltoid area, in the arm. In the arm, it is 0.5 ml subcutaneous. Now, there are typical MCQs which are related to the yellow fever vaccine per se regarding the storage and management control. Please note that this vaccine has to be stored. I'm not talking about the peripheral centers. This vaccine, of course, is not available at the sub-centers, health and wellness center, Asha worker, Anganwadi worker. It's not there. This vaccine is only at the designated places. So this vaccine has to be stored under special situations, under special temperature maintenance. That is, it is stored from plus 5 degrees. From plus 5 degrees to minus 30 degrees, preferably below 0 degrees Celsius. You actually put it in the freezing area. So this goes in the minus degree. That is what is storage. And you should be diluting with the diluent which is provided, which should again be cold. And once you dilute this after reconstitution of the yellow fever vaccine, the vaccine should be used within 30 minutes. It should be used within 30 minutes, given as 0.5 ml subcutaneous. It has to be used within 30 minutes, otherwise there is chance of contamination. Once we vaccinate the person, once the person is vaccinated, so the immunity will start. Immunity starts when? Immunity starts after 5 to 7 days. Usually after 5 to 7 days, the immunity will start. And once it starts, the immunity will last for lifelong. So that is about the immunity. This vaccine is typically effective vaccine, 17 Delta vaccine, which is a live attenuated vaccine mixed with diluent. Please note that there are some contraindications to this vaccine. This vaccine should not be, it's a live vaccine, it should not be given in case of pregnant females. So pregnant female, pregnancy is a contraindication, but in case the female has to do urgent travel, in case of urgent travel, or there is outbreak, in those cases, the pregnancy point is overruled. Try understanding. I've said two things over here. Is pregnancy a contraindication? Yes, because it's a live vaccine. If there is a pregnant female who is living in India and she wants to go to Africa, she's pregnant, she wants to go to Africa and then come back. Will she be allowed to enter Africa? That's okay if she enters, but will she be allowed to come back? Answer is no. Because she is pregnant, she will have to take a vaccine. And because the vaccine is contraindicated, now this female is advised either to take the vaccine. There is no way that she can go without a vaccine. That's what at the end of the day means. Because this vaccine is going to have teratogenic effect on the baby. There are higher chances of miscarriages, abortion, some of the chromosomal abnormalities in the baby, miscarriages, and fetal demise would be there. But all said and done, taking that into consideration, we do not allow a pregnant female to travel to yellow fever areas, at least from India. So please note that yellow fever is exotic in India. It is contraindicated. Vaccine is contraindicated to pregnant female. But in case the female says that I want to go to that area, she will have to take the vaccine and then only go. It is also contraindicated in age less than 6 months and contraindicated in cases of HIV or severe immunosuppression. So that is what you need to remember about the contraindications for yellow fever vaccine. Next is, what is the prevention for yellow fever? Like, what is the vector control measures? What is the vector? I already talked to you the vector for yellow fever, that is the Aedes mosquito. Which Aedes mosquito? It is the Aedes aegypti, which is more responsible than the Aedes albopictus. So now yellow fever is exotic in India. You have Aedes, you have the host, but you don't have the virus. So how to stop the spread? So what we do is we calculate something called as the Aedes aegypti index. Aedes aegypti index. What do you mean by this Aedes aegypti index? AAI. This Aedes aegypti index means it is the total number of houses. With the Aedes larva. How many number of houses are found with the Aedes larva within 400 meters of any seaport or airport of international connections? So try understanding what is all this. You remember from the lecture in entomology, I discussed what is the flight range of the Aedes mosquito. The Aedes mosquito can fly around 100 to 200 meters. So what we do is, let us say that there is an airport. In this airport, around the airport, 400 meters, which is roughly double the flight range of the Aedes. So 400 meters, you seal the area so that there should not be any Aedes larva. This Aedes aegypti index, it is always kept as less than 1 within 400 meters of the international airports or seaports. Why? Because we don't want any Aedes to be there. Because in case there is yellow fever, the vector should not be there. So this is what is important from the vector control. And how do you control Aedes mosquito? It's there inside the houses, inside the planes, inside the things. So you can do mosquito control measures in those areas. But for your exam, Please note what is Aedes aegypti index. It is to control the yellow fever outbreak in a country which does not have yellow fever in that particular area. That is exotic. The last point is I strategy. What is this I strategy? I strategy, it stands for elimination of yellow fever epidemics. Elimination of yellow fever epidemic strategy, that is the I strategy. So how do you do elimination of yellow fever epidemic? The only way that we do is do vaccination. So vaccination requirement for international travelers has been mandated by WHO. This yellow fever vaccine, once a person goes to any area, any country which has yellow fever, they need to take the yellow fever vaccine and then only go. So when does the effect of the yellow fever vaccine start? The vaccine will start 5 to 7 days. The vaccination is valid from vaccination certificate. Vaccination certificate is different from the vaccine immunity. The vaccination certificate is valid from 10th day after vaccination till lifetime. Till lifetime it is valid. So the vaccination certificate has to be taken. That's a yellow card we will get. So once we are flying to any country which is having yellow fever cases, we need to take the vaccine certificate. Otherwise, first is that country would not allow you to come. Second is you cannot come back. So the one is the vaccination. Second, this I strategy, it is also to protect. Three things are there. Also to protect the persons at risk. Second, it is also to prevent the international spread of yellow fever, and in case there is outbreak, and in case of outbreak, we have to control the outbreak. In case of outbreak, you have to control rapidly or immediately. That is what is the three prongs things in the I strategy. I strategy primarily is to control yellow fever outbreak elimination. By what? By the vaccination. So that's all that you need to remember for yellow fever. The next disease that we need to take up is the KFD disease. KFD, Kaiser Forest disease. KFD was reported long time back in 1957 from the Shimoga district in the state of Karnataka. Right, so it was related to monkey deaths, and that is the reason it was called as the monkey disease initially, but later on it was renamed to Kaiser Forest disease because it was associated with the Kaiser forest, and it is now called as the Kaiser Forest disease. So as always, let us talk about the epidemiological determinants, the agent factors, host factors, and environmental factors. The agent factors for KFD beta, you need to know KFD virus. It's a KFD virus, and this KFD virus is from the group B Toga virus family. Group B Toga virus family. What is the reservoir? The reservoir for this could be small mammals. What are the small mammals which are living in the jungles? They are the small wild mammals, like you can have many rodents, we can have squirrels. So it is implicated that they are the main reservoir of KFD virus. But another type of reservoir, small point, can be that the monkeys can also harbor infection. What happens is that this KFD virus is there from mammals. So that's the natural place. It goes from mammals, they infect many monkeys. Monkey, what happens is they get infected and they die. So that is the reason we don't say that monkey is a very prominent reservoir, because monkeys are technically going to amplify the infection and then die. So what are monkeys called? MCQ now over here. Monkeys are called as the amplifying host. They are called as the amplifying host. Why do we say amplifying? Because they will amplify the infection and then die. So what is, if you get beta one question like what is the natural reservoir of KFD? Answer has to be rodents or the squirrels. What is the amplifying host? It has to be a monkey, right? What is the source of this KFD disease? The source is actually a tick. It could be both effectively. It could be the hard tick or the soft tick. So the name of the tick you can remember if you want to, that is Hema physalis. Hema physalis tortura, or we can also have the Hema physalis spinigera. So if you want, you can just remember the name of the tick. Otherwise, please note that it is transmitted both by the hard tick and the soft tick. So that is the source. Now, there is another important aspect of the story. The story is that you already know there is a reservoir, the monkeys may amplify, and the ticks are the source. But who is supplying the tick? Who is there who is supplying the tick? Please note that the source, that is the tick supply, is maximum by the cattle. So cattle or horses, they have a lot of ticks on their body. So the presence of cattle and the monkeys and the ticks is all interrelated. If you stop the cattle from coming, the tick supply is stopped. If tick supply is stopped, the source is actually stopped. Are you getting it? So what is the vector? The vector is actually the tick. The vector is given by cattle. So cattle is there, which has nothing to do with the KFD virus. Cattle does not have anything to do with the KFD virus. Cattle is supplying the tick. The tick will supply the KFD virus from monkey to cattle or monkey to human and so on. So that is what you need to understand, that cattle also plays an important role in the maintenance of the infection. Why? Because they are supplying the ticks, and ticks can transmit the ticks can transmit the KFD disease. Next in line, what are the host factors? Nothing very special. The host factors would be primarily in those occupations. It's more with the high risk occupation not primarily, it's almost solely in those occupations who are working in forest areas. So it is related to forest work. People who are sleeping in the forest, people who are lying on the floor. So in those people, we have seen that there is more chances of Kajnur forest disease. Second point is regarding the communicability factor. What is the mode of transmission? Mode of transmission, we already had a word that it is by the bite of a tick. So which tick? It is the larva stage of the tick which is infective. The larval stage of the tick is infective. What is the incubation period? The incubation period for Kajnur forest disease is ranging from 3 to 8 days. So after an incubation period of what we learned is 3 to 8 days, now the patient may present with some features. So what are the clinical features? The clinical features can primarily be classified into 3 stages. We can have the first stage, that is the early stage. And then after the early stage, there is a stage 2. And then there is a third stage. In the early stage, the patient may present with fever, with the GI complaints. What are the gastrointestinal complaints? Like the person may have some amount of nausea, vomiting and diarrhea. Nausea, vomiting and diarrhea. Right? So that is just the early symptoms. And then slowly there may be hemorrhagic manifestations. Hemorrhagic manifestations where there may be bleeding from the mouth, bleeding from nose and so on. So after hemorrhagic manifestation, the patient may already be afebrile. So the fever will continue during the early phase and during the hemorrhagic phase, and then the patient may usually be afebrile for 10 to 21 days, for 2 to 3 weeks. So for 2 to 3 weeks, the patient may be afebrile, but the disease is febrile, but the disease is actually inside the body, and after a febrile phase, the patient may land up into a severe brain infection, meningoencephalitis. Meningoencephalitis may happen. So these are different stages of the Kajnur forest disease, and the patient may land up to the hospital, to the OPD in any of this stage. The case fatality rate for Kajnur forest disease is roughly high. It is 5 to 10% of the patients may actually die. And all those who recover also, they may have some neurological deficits. Based on this understanding, how to control the Kajnur forest disease? Do we have a treatment? Answer is no. There's a viral disease, there is no treatment. The only way that you can do is prevent it. The only thing that we have in our hand is prevention. So how do we prevent it? You already know that it is because of the monkey who died. That is the amplifying host. So the monkey who died must have been infested by the ticks. The tick must have been there, and the tick population should be controlled. So what do? Is we do MCQ1, intense spraying, intense spray with malathion or with BHC, high doses, 3 to 5% of BHC, or malathion 5 to 10% you can use. So high doses of BHC or malathion can be used for spraying in the area which is up to 50 meters of any monkey death, So that's kind of a different type of control measure that we have. Any monkey dying in the area, 50 meters, you have to do the malathion or this spray in case that is KFD infested area. So around 50 meters, you do that intensive spray. Then you also restrict the cattle in that area. So you can do restriction of the cattle, because the cattle is going to supply the ticks, right? So you restrict the cattle, and then you do health education. The people should be made aware not to go to the forest. If they are going, they should wear proper PPE kits, and the ticks should not be there in the body. After every day's work, you should check your body for any presence of the tick, and in case tick is there, remove it immediately. And you can also use personal protective health education of not lying on the floors and so on. You can also use personal protection measures. What are the personal protection which will stop the tick from biting us? So either we use DEETs or DMPs, we can use some personal protection measures, we can do health education, we can do restriction of the cattle, intense sprayings. So all these things primarily are going to control the KFD outbreak in the area. So with that, thank you so much for watching this whole module on KFD, yellow fever and plague for your MCQ exams.